So let's discuss teratology of fallot. What is meant by teratology of fallot? It is an cyanotic congenital heart condition. Cyanotic congenital heart condition, which have four cardinal features which are very important to know and remember. That is ventricular septal defect, obstruction of right ventricular outflow tract, that is subpulmonary stenosis, and aorta overrides the ventricular septum and right ventricular hypertrophy. So let's see it in a diagrammatic view. So what we can see, this is an heart in which we can see right atrium, right ventricle, then the left atrium and left ventricle. So in between the two ventricles there is defect, that is there is an opening connection, that is called VSD. Then the other one is pulmonary obstruction. We can see with the pulmonary artery there is some obstruction. Then it comes overriding of aorta. Then there is hypertrophy of right ventricle. What does it mean by hypertrophy? The muscles get enlarged. So in some diagram we can see there is hypertrophy of muscles. Then there is a pulmonary obstruction. Here we can see, while in normal there is no ventricular defect, but we can see here ventricular and overriding of aorta. In clinical features of teratology of fallot, there is dyspnea on exertion, but it is relieved by squatting position. We can see the squatting position. Then during anoxic spell, children start crying, which become dyspneic and cyanotic, which eventually leads to loss of consciousness. In medical management, we give oral propanol, which is a beta blocker, to prevent cyanotic spell. Then in surgical management, we do surgical correction, which is a treatment of choice. But while waiting for other surgery, we give IV administration of prostaglandin E1 to keep the ductus arteriosus opening while awaiting for the surgery.